Allegedly. Okay, we're recording us on Zoom. There's way too much. I need like an assistant. Okay, allegedly good. Hello, everyone. You're tuning in for the best live possible. I'm Dr. Jordan Leasure. I'm the owner and physician of North Shore Stop Laughing Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. And we are here with my esteemed colleague and sister, Dr. Jade Dellinger. Hello, Dr. Jade.
Hello there, Dr. Jordan. How are you today?
I'm doing very well. This is kind of weird. So tell everyone what makes you a pediatric and prenatal chiropractor.
All right. Well, I am certified. I have a CACCP. So I am certified by the Academy Council of Chiropractic Pediatrics. And that is through the ICPA. And the ICPA is an organization specific for kids, pediatrics, as well as like family care, pregnancy, prenatal, postpartum, our pregnant mamas. And so that is the organization that I chose to get my education in. So I've kind of focused my studies for the last, I don't know, time. I don't have any concept of time anymore, but I have focused my studies for the last maybe 5 to 6 years, primarily on pediatrics, as well as pregnancy, prenatal, postpartum training.
Excellent. So we are talking today on obviously a variety of topics that have to do with stress and women in stress and moms and stress, especially this time. There have been a lot of changes going on in the past 8 weeks. So Dr. Jade wanted to contribute some of her expertise in that area. So if you guys have questions as we're talking, feel free to post them. And if you have questions afterwards, Dr. Jade's contact information will be available, so you can follow up with her directly. So Jade, tell us a little bit about what is going on in the, where should we start? In the birth realm?
Yeah, I guess in the birth realm, that's primarily what I'm seeing impacts with. I treat a lot, hold on, two headphones. I don't like not being able to hear myself. I need like a special headset.
Like this, like my gaming headset?
Yeah, I need a gaming headset. A lot of changes as far as hospital procedures and regulations is what I'm seeing most of. Many of my pregnant moms have dealt with anything from the amount of support people that are allowed in the room to having to get tested for COVID if they have the time to, most hospitals are trying to test when they get in the hospital, which most of us can get a test and it takes 24 hours, but somehow they're in the middle of giving birth and they can test and get the results, fairly rapidly.
Instantly.
Yeah, instantly. It's like they know right away. That's the biggest thing, is the support person. There was a time a couple weeks ago that there was 1 or 2 hospitals that originally said, this might have been 3 to 4 weeks ago now, that said no support people in the room. So
does that include
no
parents?
Spouse?
Okay.
No, nobody. So it would be you by yourself. Spouse would not be allowed. And the regulations were a little unclear if spouse would be allowed like after the birth, because they were trying to limit the amount of people in the hospital. That has since changed, and now at least there were some groups fighting for that. Now at least one support person is allowed. So who that is that you choose, if your spouse,
so you could choose your midwife over your spouse, or
yeah, exactly. You can choose your doula over your spouse or your partner. Whoever you felt would be best to have in that room at that time.
Whoever gives a better massage, that's who I'm choosing.
Exactly. Who's the better motivational speaker? I want you. Yeah, so that's kind of the biggest change that I think we've seen across the board, because that's hospital wide. Some hospitals are allowing like a support person and a partner or spouse, so you can have your doula as well as your spouse or partner, but some are not allowing you to have 2 people or that doula.
Is there any changes to what they require if somebody's having a home birth? Do they have any say over that?
Nope, no say. Home births,
Nice.
at least in Illinois, and I can't speak for other states, but because of the regulations, or I can say, lack of regulations in the home birth realm in Illinois, those things haven't changed. What we did see is a lot of people switching to home births because of this. So just being afraid to, I've seen a lot of fear in giving birth in the hospital. Am I going to get exposed? Is my baby going to get exposed? There's a lot of unanswered questions, like, I'm going to be by myself. How am I going to do this by myself? So a lot of people trying to switch to home births, with a few weeks left in their pregnancy. We've seen a lot of that, and not people not having the capabilities to do that. There just haven't been as much available, midwives who have the space to take somebody on, even in that late in the game.
That was going to actually be my next question. Are there, and of course, we're sharing this right now in groups that are midwife heavy and doula heavy. So
Yeah.
if anybody has expertise on this topic to share, please feel free to jump in and contribute at any
Absolutely.
time. Have you seen, obviously, from the midwives and the doulas that we work with, are they changing how they are working with patients in order to observe the distancing and things like that? I know that Rita has had to make some modifications. Is there anybody else or anything specific that you've seen?
I've seen a lot of things switch to virtual classes, um, smaller groups. So I have seen some that are still holding birth classes or birth education classes in person, but maybe it's a one-on-one, or just you and your partner, or you and your spouse and the provider or the education coordinator. Many of the midwives or doulas may have already been utilizing like masks and gloves and PPE prior. Some may not have been. So I think masks have been standard. Gloves were standard before, obviously during any type of exam or anything like that. But I think, that's kind of changed on a case by case basis or on a provider basis. So I don't want to speak for any of them. I know if some are watching, that would be great to kind of know who's doing what, why they're doing what, what route they've chosen to take. But yeah, a lot of people, it's more on the education side, as well as I have one patient right now, her first pregnancy. She was seen the day that they tested and confirmed pregnancy. So I think for her, that might have been 8 to 10, somewhere in the 8 to 10 week realm. And then she was told by her OBGYN, so this is not midwife specific, but told by her OBGYN they wouldn't see her till 20 weeks. So it's her first pregnancy. She's not, which for us, I'm not anticipating, she's very low risk. I'm not anticipating anything would go wrong. Less intervention, the better. But at the same time, she's not going to hear the baby's heartbeat again till 20 weeks. There's a lot of things that kind of happen that people are hoping to get at those checkups that are a bit out of the ordinary now.
Well, for along those lines, I mean, I take for granted that you and I do this every day. So why don't we back up for a sec and
Yeah.
Tell, I guess my question is twofold. So tell everybody sort of what their options are. If I get pregnant, then what are my options, at least in Illinois, as far as giving birth in a hospital versus home versus a birth center, and who are my points of contact
Providers.
at each of those places? Yeah. And then also what the typical standard of care looks like. So I find out I'm pregnant, and then what's my next step? Or I think I'm pregnant, what's my next step?
So hopefully you've kind of put some thought into this prior to getting pregnant, but if not, that's okay. So you have a couple options. So you can give birth at a hospital, you can give birth at home, or you can give birth at a birth center. In Illinois, I don't know as far as Southern Illinois, but in the northern suburbs, there might be 2 birth centers, and there's actually one right over the border in Kenosha. And a birth center, just to kind of differentiate, is a little more on, leaning towards like home birth. I don't want to give birth in a hospital. You typically have like your own room and a bed, possibly a tub and a shower, and it's managed by midwives. who may have access or privileges to a hospital nearby. It's a little less hospital-ish or doctor-ish, you know, it's got a warmer vibe
It's a little
than the
less clinical.
hospital. Yeah, exactly. It's a little less clinical.
It's like if a
So
hospital and your house, actually, I
had
used
a
to tell
baby.
people if your hospital and the hotel had a baby, that would be a birth center.
That would be a birth center. And they're all a little bit different, but that those are your options as far as where. And then once you can kind of decide what you're thinking where, you can kind of decide the type of provider that you would like to see. So OBGYN, midwife, or certified nurse midwife are your options. And there are some midwives that deliver at hospitals. So I can't just make the, you know, blanket statement that a midwife is going to be home or birth center, because there are some, especially here in the suburbs, that have midwives in their practices, which is excellent. And you can pick, you know, let's say I want midwife or I want OBGYN, and then kind of decide where to go. Midwives typically will take on somebody who is low risk. So let's say, not in my world, but in their world, maternal age. Have you had previous pregnancies, any previous complications, your current state of health, whether that be underlying health conditions or including but not limited to like obesity, PCOS, other uterine issues. They tend to only take on those of very low risk. And the biggest difference, you know, and I'm sure if anybody or any of them are watching, you know, our midwives and our OBGYNs can kind of jump on and compare, but the biggest difference when comparing them is medical training. So OBGYNs do medical school followed by residency, an education plan for like a certified nurse midwife. You first have to be a nurse, so that comes first, and then you complete graduate training in midwifery. So like I used a certified nurse midwife, and then some people opt to do, you know, the OBGYN route.
And so
I
did
kind of got
I,
off on a tangent. So did
even due to my
that.
advanced maternal age and what was the other risk? Oh, and first baby and advanced maternal age. Well, I'm glad to see that your brain works like mine, so it's genetic. It's not my fault. So
No. And then your other question, course of care. So typical course of care, and this is, I think, pretty standard for the industry, whether you're being cared for by a midwife or an OBGYN, is monthly, and then bi-weekly, and then weekly. And where that transitions is a little bit different, but I'd say typically around the 32-week mark, you go from seeing your midwife or OBGYN monthly to seeing them bi-weekly, and then around the 36-week mark, you'd go weekly for a month, or if you go over your due date, you'd go, you know, a little bit further, a little bit longer.
So what have you seen it's funny to ask questions that I know the answer to. What
I only like to ask questions I know the answer to.
What have you seen in our practice as far as, and not necessarily just during this time, but as far as treating mothers or seeing mothers that are either looking to become pregnant or are pregnant, what improvements or changes have you seen? You're in my video. You're worse than Parker. Have you seen as far as improvements with pregnancy and or labor and delivery,
like outcomes
for those that are under, yes, chiropractic care?
Great improvement, actually. And this is, I can just say our practice specifically, so I won't even pull the studies, because I know the studies say that chiropractic is very beneficial when you are pregnant in both pregnancy outcomes and labor outcomes. But practice specific, I get a lot of referrals from those who are looking for a VBAC. So women who have had a cesarean for whether it was their first, second, third, whatever number, but they've had a cesarean and they are looking for a vaginal birth. That's what a VBAC is, vaginal birth after cesarean. I get a lot of referrals from those. There's some Facebook groups. So shout out to those Facebook groups. And we've seen a lot of success. I think our last 4 women who were looking for a vaginal birth after cesarean successfully had a vaginal birth. And, you know, as always, I believe chiropractic played a very significant role in that, as well as them being very diligent to do whatever was recommended to make sure they had the birth that they wanted, and whether that included on the nutritional side, on the activity side, but they followed all the pillars necessary to make that happen for them. And one of those pillars would be chiropractic care. So,
and I think don't you think the confidence in recognizing the power of the body?
Oh yeah, that you can do it, you know, and just knowing that you don't, many of them too was, you know, had I known now what I knew then, you know, even that pregnancy or labor and delivery would be different, you know, just being more, you know, sometimes the first you don't know better and you just kind of go with the flow. And then after that, you kind of start to dig a little bit deeper to find out your options, things you can say yes to, things you can say no to, where you can say yes, where you can say no.
You're more empowered.
Yeah, absolutely. Seeing that a lot.
How would you, or do you, you know, guide your patients in things that they should do? Again, either if they're looking to become pregnant, if they're already pregnant, things that they can do so that they have a birth plan. You know, there's some people probably don't even know what that is. If I can steal the show for a second, I found an app online and I made a birth plan that was pictures so that it was easy to see, easy to understand, and it was divided into, really?
No.
Well, that will be
that
available
might be beneficial
for $19.99. For $19.99 on our website.
Hold on, HIPAA. I've got exposure to the entire back office.
So what you can see is what I wanted done, for the baby during labor, and then what I wanted done for him after labor. So for instance, a couple things, I almost under no circumstances wanted any sort of interventions. So
Sorry.
it's always something, hence the little sister. I wanted to make sure that I, again, until there were extreme measures required, was when I wanted somebody to step in. I didn't want any medication. I didn't want an epidural. I didn't want anything. You know, at one point they actually had to ask me, and I think they asked Will, if they could give me fluids, because and again, for first pregnancy, my labor was relatively short. I think it was 12 hours. But I wasn't drinking as much water as they wanted. So they asked at one point if they could give me fluids. But other than that, I did not want Parker to have a bath. I wanted delayed cord clamping. I wanted, what else? I think you could put on there, like, if you wanted to eat or not eat. And, you know, that's how specific it can get. And if you wanted to labor in the tub, or if you wanted to labor in the bed. And then positioning was very important for me. And I guess, Jade, if you're comfortable getting into that, you know, what the American standard of women positioning, or the labor, when you see a woman laboring in a movie, what it looks like versus really what it should be. And that was very important to me. So I was determined that when it got to the point where I was in active labor, which for a lot of us is, you know, the very end, and my active labor was 2 hours, I wanted to be squatting, because, and I'll let Jade get into the why, but I literally had that on my birth plan. So everybody knew the game plan. So Jade, you can.
Yeah, so I missed some of that when my very professional backdrop fell. But yeah, birth. So let's go back to birth plan. So number one, birth plan. Like, a birth plan is very important across the board, regardless of where you are giving birth. So if you're giving birth at a hospital, at home, in a birth center, always have a birth plan, and it's important to share that birth plan with your provider or work out your birth plan with your provider, because sometimes you don't even know that you have choices in some of the aspects of the plan that you have choices for. So whether it's something that I'll say is new as far as when I started working with or studying to work with pregnant women and pediatrics, was that if you are giving birth in a hospital, you can actually ask them to turn the epidural down. So when it comes close to pushing, you can actually have them turn it down so you can feel the push. So for women who have given birth, being able to feel that is a very important task, to know how much to push, when to push, being able to push on a contraction as opposed to being told that you're on a contraction, it's time to push. You can kind of follow your body's natural rhythm in order to push the baby out. And we find that sometimes there's less tearing, if tearing does happen, if we're able to feel it, so we can kind of tell when to push and when not to push. Some women don't know that, so you can put that in your birth plan. If possible, you know, when it comes time, turn the epidural down, or I want fluids, I don't want fluids, you know, all of these types of things. And the birth plan also includes plan for the baby. So, you know, do you want a bath right after? Do you want skin to skin contact right after? Vitamin K, delayed cord clamping. Are you planning to breastfeed? You know, all these things should be in there, because when you get down to it, if you haven't had pain medication and you reach that transition, which is when women say, you know, they're going to die, I'm not going to survive. It's usually the shortest part of labor, but it is the most intense part of labor. You don't care what they do at that point. So give me the epidural, give me the pain meds, get the baby out, cut it out. I don't care. I'm done. And you'll
I actually
regret.
said that. I didn't ask for pain meds, but the midwife was like, "Oh, like we can see his head. Do you want to touch his head?" And I looked at her and I said, "If you could see him, you pull him out." And she knew I was obviously
we were in that phase. So yeah, so I always, you know, birth plans are very, very important, and obviously reviewing them early with your provider is important, as each hospital has different things that they will allow you power over and things that they won't allow you power over. And I think it's important to know that before going in, so nothing's a surprise. You know, this is your birth, your labor, your delivery, and it should go as you would like it to happen. And if that hospital is not going to allow you what you would like, then you need to find another place to birth that will. And, you know, the earlier, the better, so you have time for that transition.
And I think having your partner or your support staff or whoever that may be on board with that, same thing, on board with that early, and having them know your non-negotiables, so that if you're at that point where you are, you know, in excruciating pain, or you know, like they want to give me fluids, and if I had said absolutely nothing and that's a non-negotiable, and they asked Will, and it would have been his job to say no, she said no. And you know, some of those things should be non-negotiables, and some of them, you know, depending on your on the situation, you may be more malleable in your thoughts. And someone that is clear-headed, which hopefully is the partner or the employed support staff, should be able to hold your ground on some of those things.
Yeah, absolutely. I don't remember what you said, what you talked about after. Oh, positioning.
Yes.
Yes. So typical, obviously most people have seen a movie that had a woman laboring or birthing in it. Those of us who are in the industry have seen appropriate videos, so ours are very different than the movies. But the movies most have women laboring on their back. And that's typically because they've already had the epidural and they can't move. So when you get the epidural, you're going to be numb from the waist down. You will not feel anything from the waist down, if pending the intensity of the epidural that was given. And if it works, right? So if the chemical takes hold and it works, you will be numb from the waist down. The problem with that is that it doesn't allow you a few problems. Is that it doesn't allow you to labor in other positions. So gravity cannot help Laying on your back restricts movement of your sacrum, which is what should move like this in order to help kind of work baby out. And it doesn't allow you, if you do get stuck or are not progressing, the things that will help you progress involve movement. So if you've already had the epidural, and that's, if that's your, in your birth plan, I want the epidural, that's my plan. This is how I picture my birth. I'm, whatever the reasoning is, okay, that's your plan. But I always recommend see if it can be delayed. So see what's the latest, and take a birth class so you can manage those contractions as long as possible, and see if that epidural can be delayed, so that if you need to walk around, if you need to squat on a ball or bounce on a ball, or whatever the different, because it be on all fours, stand, supported standing. If you need to do some of these things during contractions, that may help you progress to 10 centimeters or progress further. So let's say if you're at 10, it's a little late for the epidural. But you're already there. You might as well just go all the way. But if you're having trouble getting there, you need to be moving. And that's the biggest thing. So, labor position on your back for most people tends to be longer. You might push longer than the pushing stage if you're able to push in another position, because you're just not having gravity assist or able to open the sacrum and the hips, wide enough to get that baby out.
Good work.
Thank you.
Are there any final thoughts that you have based on what you've seen to help women that are, again, currently pregnant during this time? Everybody's talking about the stay-at-home order, and there's going to be a whole new inventory of little people in the winter. Are there certain things that
Winter is coming,
that you would suggest that moms can do, or moms to be can do, to make this time a little bit easier?
Yeah, I mean, honestly, I wouldn't, if someone was trying to become pregnant or thinking about becoming pregnant, I wouldn't let this change your mind. There's never the perfect time. So if you were, in the process of trying to become pregnant, I think that you continue down that path. And if you already are pregnant, regulations are changing every day. The one thing I wouldn't do is rely on your hospital to change. If you are dead set on having a partner and a doula, or I'm dead set on doing this and this, and the hospital has a regulation in place, I probably wouldn't wait, like pending on when your due date is. I probably wouldn't wait for that regulation to change, because we don't know day by day what those look like. So if there's something that is your non-negotiables and it's not in practice currently at where you're planning to give birth, then you might want to look for an alternative sooner rather than later, so you can get it under somebody's care. They can get to know you and the baby and kind of take care of you from here forward. And stress, if you're currently pregnant or trying to become pregnant, stress, baby feels stressed. So if you are feeling stressed, you need to work on stress relief as much, and if not more, than diet and exercise, because baby feels all that, and it will decrease, baby's happy hormones if you're stressed. And same with, birth and labor, and everything will be easier. There are some things that are out of your control, and, I say we got to let those go. And the biggest goal is getting a happy, healthy baby out with a happy, healthy mom. And if that means in the hospital, and that means that one person can be there and it's not the birth you envisioned, that's okay. It's, have a backup plan, and get okay with that plan in your head, so that there's no labor disappointment, because that does happen, and just make sure that you're okay with get okay with how it's going to be, because that is what it is right now. And if it changes, then it's a good, happy surprise. But, baby would rather feel these happy hormones, and getting pregnant when you're not stressed is a heck of a lot easier than if you are stressed, because it manages and regulates those hormones. And we don't really have time to touch on this, but maybe in a later video, a preconception period is 6 months prior to becoming pregnant. And you actually change your follicles. You change the DNA of your baby 6 months before you even become pregnant. So if you get pregnant now, how have you behaved the previous 6 months, whether it's food, stress, activity. And if you've been naughty across the board, you've been very stressed and eating crappy and not exercising, the DNA and the follicles of your baby, you've already started to create that. So stress is really important. I know that that's kind of what we've been focusing on across the board, and, getting okay with an alternative birth plan and just, rolling with the flow and getting home to take care of the baby as soon as possible. So have the baby in the hospital or, birth center, whatever that may be, and then get that baby home to bond and take care of, in a more happy, homey, secure environment.
Awesome. Well, good. So if there's anything that we didn't touch on, please, again, feel free, post questions below, or you can contact Dr. Jade directly. Dr. Jade, are you currently accepting new patients?
I am currently accepting new patients, pregnant and not pregnant, littles and bigs, all of them.
Yes, for those of you that don't know, pregnancy and prenatal chiropractors also see little people as well. So Jade has quite an extensive following of people that get their own table that are ages, well, Parker was
0.
like minutes old when he was born, so let's say 0. So it works out well.
Yes.
Maybe we'll do a video on just them as well.
I think so. That would be funny.
Awesome. Well, thank you for joining me. I appreciate your time, Dr. Jade. And
anytime.
I'll see you at the office later.
See you in a minute. Are you in the other room? Just kidding.
I thought about it. I thought we'd hear each other echo, so I thought it'd be too weird.
That'd be funny.
Awesome. Okay. I love you all.
Thanks, everybody. Bye.
We'll see you later. Bye.